As Dr. Walter mentioned, I am currently a professional field service veterinarian with Boehringer Ingelheim. My presentation today is to discuss the ileitis vaccine from a production system standpoint, particularly what we're going to cover is the decision process that went about in a production system. And we're going back to 2002 when we talk about that, because that was when the vaccine first became available. Some of my experiences on barriers to implementation, and some of the solutions to that, and also some of the results that we saw in that production system. The decision process was fairly easy as it pertained to replacement gilts and replacement animals going into either to the bore stud or replacement gilts. From my years of experience in swine production, from a veterinarian standpoint, there's nothing more frustrating than having replacement gilts break in the sow farm with ileitis. There's nothing more frustrating than having a startup or a depop repop and have animals break with ileitis because they get really sick, they're hard to treat, they don't respond as well as it seems to me as the grow-finish pigs do, and certainly you lose some production losses as the breeding targets suffer. So it was a pretty easy decision at that point in time to place it into the replacement gilts immediately, and then at that point in time certainly use those as a barometer to evaluate the efficacy of the vaccine from a producer's standpoint, but also take a closer look at the economics of why you would want to vaccinate for ileitis. I think during the decision process, certainly there's the cost of the treatment of clinical ileitis, and it's pretty easy fire drill to go about when you do get a break with ileitis in the grow finish barns. The first thing you do is individually treat animals. Second thing you do is you put the whole group on water-soluble antibiotics. And the third thing you do is you put feed-grade antibiotics into the bin. Usually when a ileitis breaks in the grow finish, the sequence of the feed-grade antibiotics being perfect to when you want to treat doesn't work. There isn't in sync. So that's why water soluble is how you go about it. Now the issue with that is certainly there's a cost associated with doing that. It's a fairly treatable disease. You do get some mortality in a clinical break. You will see some mortality. So that is a cost, as well as the individual animal treatment. So that has to be factored into the decision of how many groups of pigs do you have that have clinical ileitis. And you can run up a fairly good antibiotic bill, individually treating animals, water-soluble treatment for 3 to 5 days, followed by feed-grade antibiotic. And certainly part of the decision process is the cost of the use of the feed-grade antibiotics to decrease the incidence of ileitis. Those are the ones that do not show clinical signs. That is the subclinical ileitis. And certainly what I was fearful of, and as well as others, is that you do, under those cases, you do see a reduction in average daily gain. You will see a reduction in feed efficiency or a worsening of feed efficiency. And probably more importantly, which is hard to measure, but I think with the Packer information coming back today, the number of lights at market is going to be an easier measure today than it was back in 2002.
A little louder.
Okay. So, and this is probably as we got into the evaluation phase of why would we want to vaccinate for ileitis, it's a management advantage. Anytime a veterinarian or anytime that you can remove a disease from the treatment list, something that you can put to the side and you do not have to worry about from a treatment standpoint, is certainly a huge advantage. When talking about feed-grade antibiotics, and Dr. DePietri talked about cost control, that is an easier way to cost control on feed-grade antibiotics is if you do not have to worry about ileitis as a disease. it can certainly, from personal and practical experience, monitoring and controlling the feed budget or the feed grade antibiotic budget with ileitis floating around and people needing to make decisions on treatments from a feed grade standpoint, it certainly could get out of control really quick. So after all that evaluation, it was certainly the decision made in the production system that I was working with was to go ahead and vaccinate with ileitis. Some of the barriers that I'd like to talk to you about, certainly that came up because it was back in 2002, is a new novel approach to, at least for us anyway, it was a new novel approach to vaccinating pigs through the water. So one of the things that was stressed by BI to me is that the need for a medication-free window. So you have to decide when is the best time to get that medication-free window. From my practical experience is the first phase was when you could hand feed pigs and so that you could make sure that they did not get antibiotic, and that would have been early after weaning. That would have been 7 to 10 days after weaning when that would have been implemented. That has some associated, that young a pig certainly has some associated, on the downside or the flip side of that, that phase of the nursery pig is when he responds the most to antibiotics in the diet. So you're giving up a little bit of that. It was quickly decided that, okay, that's not so good, not a good place. So why don't we go to where we can keep the feed bins empty, and that would when pigs arrive at the finisher. And this was a system that had a nursery finish. It wasn't a wing to finish system, it was a nursery finish. So pigs arriving at the finisher, you could assure that the bins were empty so that feed grade antibiotic could go in at that point in time. Once again, you got the mixing and sorting of pigs, and it became pretty clear that that's probably not the best place to do it either. So what was settled upon and has continued to do that way is somewhere in the mid phase of the nursery when they've been in there 3 to 5 weeks. That seems to be the sweet spot on where you can certainly get the medication-free window established. Some basic principles of this is that you have to associate that also with vaccine timing. And you have a window of about 4 to 5 weeks of age up to exposure usually occurs, and at least in this system it was occurring at about 10 weeks of age. And so you want to avoid the passive interference from the sow farm, from the sows, the maternal interference, and you want to get far enough in front of natural exposure to the Lawsonia organism. And so the sweet spot in there is 6 to 10 weeks of age, and that would be concurrent with what the production system I was working with was 3 to 5 weeks after placement. So that would have been in that 6 to 10 weeks of age range. So 6 to 10 weeks of age, mid to late nursery, health status permitting, is probably the window that you need to be looking at vaccinating. Okay, just a refresher on the vaccine. Minimum of 7 days, preferably longer, of a medicated-free window. 4 days pre-vaccination, medication-free. Do it right in the middle, and then vaccinate on day 4, and then maintain the medication withholding at least 3 to 4 days post-vaccination. So you need at least a 7-day window. 10 days is preferred. Longer would be great, but that's a minimum. As with anything, you have to do what's best for the pig. So in those particular cases, if pigs need individual treatment, then you should go ahead and do that. I think the important thing is what we're doing is vaccinating the group for ileitis. So there'll be a few pigs that may need more treatment right now that you cannot wait on. And that's understandable. Withhold appropriate meds per vaccine. Certainly the long-acting injectables suggest a 14-day pre-vaccination window. If Exceed or Draxxin is part of the normal protocol, you have to assume the fact that they're going to last 14 days. So vaccination after that period of time would be warranted. One of the simple solutions to a medicated-free window is to have the feed mill manufacture feed that has iron sulfate in it, or the red color, and that forms twofold issues. It certainly alerts the management at the farm where the vaccination is going to occur at, that the window is now feed grade. Now no feed grade. There's no feed grade antibiotics in the diet, so the color would indicate that, as well as it's key for the feed mill to manufacture to put in iron sulfate, so that they know that they cannot have feed grade antibiotics in it, and that's worked quite well. Very good cue for everybody to be on the same page. As you can see, the ones on the right are the iron sulfates. The ones on the left are the do not have the coloring in it. Another thing that in the system I worked with that was pretty clear is that it's best and preferred and almost mandatory to empty the bins prior to the non-med feed delivery. That makes it sure that there's no mess-ups on the medicated-free window. And deliver enough non-medicated feed for 10 to 14 days. And after that period of 10 days, and they can go ahead and pour medicated feed on top of the non-medicated feed. Some of the results that we an and this certainly was an attempt to justify or to evaluate that yes, this was an improvement in production. Certainly this does not have the statistical power that I'd liked, but it was kind of our best way of evaluating at the system and this was barn closeouts. This was comparing 20 barns before vaccination compared to 20 barns on both sides of it. The results that we saw was about 0.4 of a pound per day gain in average daily gain, and that amounted to about a 10-pound pig heavier. About a 6-pound pig heavier, and improved feed efficiency of about 0.3. The results that you look in the literature, they would be very comparable to that. There's an improvement in average daily gain and improvement in feed efficiency, and it certainly has the statistical power behind it. This one does not, but we found out very similar results.
You're doing fine.
Okay, the message that I would like to leave with you is probably the most important results that you can see is improvement in light marketings, and that's a big one. That's probably where the most money is going to be improved, is improvement in lights. And the second most important thing that I think is you give the management an advantage by removing a disease from the treatment list. And anytime you can do that, it's very similar to the mycoplasma vaccine, erysipelas vaccine. Anytime you can remove a disease from the treatment list, you can get the management of the barns, of the pigs, to focus on the pigs and not worry about those things that could happen.